So if you can just pop your right hand to mark the towel height on the left side of your chest there, just to onto the towel. And what it's going to do is stop the towel from coming off anywhere, which shouldn't. So I'm just going to bring the towel back so we can see the back. And is that okay to undo your bra strap?
Yeah, fine.
Okay, we are looking at the lats. Yeah, I'm not going to move the arm just yet, we can do it later on. So we can put the arm in a position where it's going to stretch the lats like that, as long as they've got no underlying issues that make that painful. But I'm going to show you two different techniques now, so we can have a look at both, so we can then move on to static. So we're looking at the lats first of all, and the reason I show this, even though I think it can be quite self-explanatory at this stage, to show some areas where it can be a little bit more tender and more painful, can mark a bit quicker, might even get some speckling there, but also just the benefits of treating lats in this way, because we are limited as to the pressure that we can put down with massage strokes. So make sure that you get enough wax on all the areas that you need to. Start with one pump initially, and try and get yourself as far up into the origin or the insertion of the lats as you can, and then back down. And we're looking to just cover every square inch that we can of tissue with the cups. Is it all right?
Yeah.
Yeah, we can go over that acromion, spinal scapula as well, but targeting the lats mainly. We're going to show you some techniques later on where we get that arm moving as well to bring the lats into a stretch. But for the moment, we're just seeing how it feels, having a look at marking and erythema. So there's some, I'd say slightly more angry looking erythema there, but still nothing to worry about. Just keep an eye on that area because it can speckle. So dynamic cupping of the lats, quite self-explanatory. Yeah, we'll take a look at the upper traps as well before we can then move on to static. Dropping the strap down, hair out the way, a little bit of work into the upper traps. Don't overwork this area because we're going to do some more on that later on. Slightly smaller cup. I'm going to get probably the two slightly smaller ones, not the smallest. There's actually very little that we can do with that. Start with the bigger of the two. That can happen, which is why we've got the smaller one. Try and go with the bigger one if you can, but no, it's not going to work. Try to get your head straight up. Try and go as high up as you can to the hairline. Back down, following the blade to scapula. And the rest of the upper traps. Don't forget the back of the spinous process. Anybody know the name of the ligament that runs along there? The nuchal ligament, ligamentum nuchae. You can get short and tight in that position. So make sure you give that some love as well.
That's a nice one on the neck.
Yeah, right on the back?
Yeah.
It's always reassuring when you say these things.
So that's longitudinal and then a bit more transverse. Try and stop when you get to the superior aspect. Don't go too far around. You can go around into the upper traps, but I'd avoid going around as far as the scalings. See, I've got the pump in my hand because it is inevitable that it's going to pop off. And that's just because of the different contours of the body in this area.
Would using the smallest cup make any difference?
Yeah, using the smallest cup, the problem is the pressure in that because of the decreased size of the cup.
Oh, okay.
It can make it very painful quite quickly. So you might want to, but usually I don't use that as static, just in place. So two more techniques for you there, very simple, and then we're going to move on after that. Lats and upper traps.